There's a new study out with some important findings looking into the vaccine and the effect on pregnant women and their babies specifically. NBC's Ling has that story for us, and she has it because it's a story that's very personal for her.
Yes, that's right, Craig. Good morning, everyone. You know, when the vaccine first became available to healthcare workers, it included pregnant women, and some chose to get the vaccine, though pregnant women were not enrolled in the early clinical trials. Well, that has since changed, and what we do know is that pregnant women fare worse than others when they're infected with COVID-19. But now a new study is revealing documented benefits of getting the vaccine while pregnant for both mom and child. And that information perked up my ears and helped me make a very difficult decision of my own. As vaccine eligibility for mothers-to-be opens up nationwide, pregnant moms are facing a big decision about vaccinating for two. And new research is providing encouraging evidence. In the largest study of its kind to date, researchers at Massachusetts General and Brigham and Women's Hospital found COVID-19 vaccines to be highly effective in producing antibodies against the virus in pregnant and lactating women, giving them significantly higher levels of protection than through natural infection. The findings also showing the vaccine passes protective immunity to newborns through the umbilical cord, placenta, and breast milk. The authors adding babies born to moms in the study were healthy and doing great at that time.
In a few short weeks, my little guy is going to be here.
The ever-evolving situation prompting Molly Mendoza to jump at the opportunity to participate in a new Pfizer clinical trial. Mendoza is 30 weeks pregnant with her second boy.
What made you want to sign up to be part of an official vaccine trial?
I am very much a woman of science. I do believe that, research is necessary, and now especially more than ever.
Mendoza gets her shot in the arm next week, either the vaccine or a placebo. The purpose of this trial, to find out if mRNA vaccines like Moderna and Pfizer protect the baby too. Her hope, help pregnant women earlier on in their pregnancies make an informed decision.
You want to protect your child from as many things as possible. And to know that I could protect my unborn after they're born and then also help other moms to feel that same way is amazing.
OBGYN Dr. Max Rogers is working on the study and recommends that healthy pregnant women get vaccinated.
It took giving several million doses of this vaccine to garner more information and enough information for us to feel secure in recommending it to pregnant women.
But also says it may not be right for everyone.
I would withhold recommending this vaccination to any woman who has had a very complex or problematic obstetrical history, such as someone who had significant recurrent pregnancy losses, or an individual who had delivered preterm infants repeatedly.
With so much new research coming out at a record pace, it helped this pandemic pregnant mom make a big decision of my own.
So after lots of discussion, I've decided I am gonna go get my vaccine. A little nervous, but I'm more excited than nervous. Oh my God.
Awesome.
Wait, that's it?
Yep, that's it. How do you feel?
Vaccinated.
Down the line, what are you going to tell your son about what happened in this period in this vaccine trial?
That's what I'm going to tell him, that every decision that I've made has been for him over me every step of the way.
I couldn't agree with Molly more. We are so excited to be welcoming a little girl, and I've got my vaccine card in hand, that first shot all done. But I wanted to add that the American College of Obstetricians and Gynecologists say outcomes are a result of contracting COVID-19. They could be far worse than the theoretical risks of vaccination, and they recommend that pregnant women have the opportunity to get vaccinated. And medical professionals and the CDC say this is, of course, a really personal choice. They always recommend consulting with your doctor first, which is what I did many, many times. Ask all the questions, assess your personal risk, and ultimately this decision, of course, in this huge debate is up to you guys.
How do you feel? How did you feel?
Thank you for asking. I feel great. I don't feel anything yet, but I've only had the first shot. I've heard the second shot, it kind of brings on a few more weakness symptoms. Maybe I'll be sleepier. Not sure yet, but feeling good so far.
Well, Joe, that's a big decision.
It is.
And so I know a lot of women who are in your position are probably watching you, and you're a smart woman. So I know you did your homework on that one for sure, as you said.
Good to see you, Joe.
Good to see you too.
Congratulations again, Joe.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.